Zinc has so many health benefits, it's almost impossible to cover them all. This mineral has potent antioxidant and anti-inflammatory effects. It's essential for immunity, reproduction, mental health, skin health, cognitive function, and much more. Zinc is an essential mineral found in all organs, tissues, and fluids in the body. As the second most abundant trace mineral in the body after iron, it plays a pivotal role in a variety of biological processes. Zinc is required for the catalytic activity of more than 300 enzymes that are involved in the synthesis and the metabolism of carbohydrates, fats, proteins, nucleic acids, and other nutrients. Zinc also plays roles in stabilizing cell and organ structures, immune function, wound healing, cell division, growth, blood clotting, thyroid function, vision, taste, smell, and more. Despite having so many critical functions, it's not stored in the body, and it requires a regular dietary intake. Good dietary sources of zinc include red meat, seafood, dairy products, nuts, legumes, and whole grains. Zinc is more easily absorbed from meat and animal proteins. Vegetables are not ideal sources because they contain phytate. This is a compound in plants that prevents zinc from being absorbed. Because it plays such a crucial role in the immune system, a zinc deficiency contributes significantly to the global burden of disease, making it a major public health issue. Groups that are at risk of a zinc deficiency include people with digestive disorders, vegetarians, pregnant and lactating women, alcoholics, and people with sickle cell disease. Oral and intravenous zinc supplementation can prevent and treat zinc deficiency of different origins. Cases that may require prompt intervention can include severe diarrhea, malabsorption, liver cirrhosis, alcoholism, and renal failure. Many studies show that in infants and children in developing countries, zinc administration reduced the duration, severity, and the incidence of acute and chronic diarrhea. Zinc supplementation is likely effective in treating Wilson's disease, which is a disorder where copper accumulates in the tissues. It blocks copper absorption and it increases copper elimination in the stool. Zinc acetate is an FDA-approved drug for the treatment of Wilson's disease. People with acrodermatitis enteropathica, which is a genetic disorder affecting zinc absorption, can experience skin irritation, hair loss, diarrhea, and high rates of infection. Zinc supplementation in therapeutic doses usually results in a complete recovery. Studies have shown that zinc levels are often low in people with atherosclerosis, which is hardening of the arteries, and in heart disease, chest pain, and heart failure. One study found that a higher rate of heart failure was associated with zinc deficiency. According to one clinical review, high doses of zinc are able to prevent and treat angina in patients with atherosclerosis. In a meta-analysis of 24 studies and 14,515 participants, zinc supplementation significantly reduced the total cholesterol, the LDL, and the blood lipids. A reduction in these markers may lower the risk of heart disease. Scientists observed the potential of supplemental zinc to protect the heart from stroke-related injuries in rats and mice also. Zinc ions can bind to insulin receptors and activate insulin signaling pathways. By mimicking insulin, zinc reduces excessive insulin secretion by pancreatic cells, and this helps to protect the pancreatic tissue from damage. Because of zinc's essential role in the processing, storage, and secretion of insulin, a deficiency can lead to increased insulin resistance. Studies have found that pre-diabetic and diabetic patients were more likely to be zinc deficient. Studies in women report that higher dietary zinc intake may reduce the risk of developing type 2 diabetes. A meta-analysis of 22 clinical trials confirmed significant benefits of zinc supplementation for blood sugar control and insulin function. Zinc may also decrease the severity of diabetic neuropathy or nerve pain, oxidative stress, and cholesterol and triglyceride levels in type 2 diabetic patients. Zinc, both oral and topically, can benefit a variety of skin conditions like acne, warts, rosacea, eczema, psoriasis, melasma, and dandruff. In people with acne vulgaris, zinc supplemented groups showed a significant improvement in their symptoms when they were compared with placebo groups. Clinical trials in patients with viral warts resulted in a complete clearance of the warts for a majority of the zinc-treated individuals, both orally and topically. Zinc exhibits similar efficacy in treating herpes, which are warts caused by the herpes simplex virus HSV1 and 2. A study in people with rosacea, which is a chronic inflammatory disease characterized by flushing, small blood vessels, and red bumps on the face, showed that oral zinc was able to reduce disease symptoms. Zinc supplementation exhibits similar efficacy in treating other inflammatory skin disorders like psoriasis and eczema, likely owing to zinc's anti-inflammatory and antioxidant properties. Zinc may also treat seborrheic dermatitis or dandruff. Studies show that shampoos that contain zinc can significantly reduce the scaling and the inflammation that's associated with this dandruff. Zinc also protects against sun damage to the skin, which can cause skin aging and cancer. A study in humans found that a sunscreen containing zinc was more superior than titanium oxide in providing protection against ultraviolet radiation. In a meta-analysis of 17 trials and 2,400 participants, low blood levels of zinc were associated with more severe depressive symptoms. A dietary intake of zinc was inversely associated with depression rates in another meta-analysis of 9 studies. Zinc supplementation significantly improved the efficacy of standard treatments with antidepressants in 3 trials on 118 patients. When given to 30 young women with impaired mood, zinc significantly reduced anger and the symptoms of depression. A study found that zinc therapy was able to improve overall mood in 46 overweight subjects, likely through an increase in BDNF levels, or brain-derived nootropic factor. One of the earliest signs of a zinc deficiency is a loss of appetite. Clinical studies in patients with anorexia nervosa show a significant association between the disease and low blood levels of zinc. Many trials with oral zinc supplementation have reported an increase in weight gain, muscle mass, appetite, taste sensitivity, and food intake in anorexia nervosa patients. In one study on rats, zinc supplementation was able to rapidly stimulate food intake by increasing orexin and neuropeptide Y. Zinc is essential for the normal development and the function of many immune cells. Because of the critical role that it plays in the immune system, even a mild deficiency can impair immune function and increase the risk of bacterial, viral, and parasitic infection. In clinical states that are associated with immunodeficiency, like sickle cell disease, HIV, or in the elderly, zinc supplementation can restore natural killer cell activity, lymphocyte production, and resistance to infections. Studies in HIV patients with low blood zinc levels reveal that chronic supplementation is associated with lower opportunistic infections and a reduced risk of immunological failures. In malnourished infants and children in developing countries, zinc administration reduced the duration, severity, and the incidence of diarrhea, respiratory infections, and malaria. Similar beneficial effects were reported for other infectious diseases in humans, including leprosy, tuberculosis, and hepatitis C, and even the common cold. On the other hand, excessive levels may suppress immunity. A study in healthy young men revealed that high doses of zinc reduced several immune functions, including activation of lymphocytes and phagocytosis of neutrophils. Owing to its immune-boosting properties, zinc is among the most popular supplements for a common cold. Most clinical trials and reviews show a significant decrease in the duration of symptoms in adults. Zinc gluconate and zinc acetate supplements with 9 to 24 milligrams of elemental zinc per dose have shown the best results when initiated within the first 24 hours. Research is less convincing when it comes to using zinc for common cold prevention. In a trial of 400 children with ADHD, zinc supplementation was significantly superior to a placebo in reducing symptoms of hyperactivity, impulsivity, and impaired socialization. In combination with standard treatment, zinc supplementation reduced hyperactivity and impulsivity in 44 children with ADHD. Zinc was particularly effective in obese children with zinc deficiency. The potential benefit for children with adequate zinc status is less clear. Age-related macular degeneration, a major eyesight issue in the elderly, is believed to be caused by oxidative stress. Clinical studies have found that zinc supplementation can slow the progression of the disease, possibly by preventing the oxidative damage to the retina. Most studies use zinc in combination with other antioxidants like vitamin C and vitamin E. Preliminary research suggests that zinc may protect against diabetic retinopathy. This is because of zinc's ability to reduce oxidative stress and inflammation through inhibition of the NAD-PH oxidase and NF-kappa B. Night blindness is one of the earliest symptoms of a vitamin A deficiency. A study found that zinc was able to enhance the effect of vitamin A in restoring the night vision of pregnant women with low zinc levels. Zinc supplementation was able to enhance cognitive recovery in 26 zinc-deficient stroke survivors. Zinc supplementation resulted in superior neurophysiological performance, particularly attention and reasoning skills, in a study of 372 children. In studies of almost 300 malnourished infants and toddlers, zinc supplementation led to increased activity as well as mental and motor development. On the other hand, zinc supplementation improved growth, but it failed to improve cognition in 16 zinc-deficient children. Maternal zinc supplementation enhanced spatial learning and memory in rat pups. A study showed that zinc supplementation improved symptoms like cough, wheezing, and shortness of breath in 284 children with asthma. Low blood zinc level may be linked to more severe asthma symptoms in some children. Zinc was also able to reduce airway inflammation and oversensitivity in mouse models of allergic inflammation and asthma. In response to grass pollen, zinc increased regulatory T cells and it decreased proliferation in peripheral blood mononuclear cells, or PBMCs, which were isolated from allergic subjects. Zinc deficiency is linked to a delayed wound healing in some patients. Adhesive tape with zinc enhanced the repair of skin ulcers in a study of 44 diabetic patients. 2 studies of 58 participants showed that zinc administration, oral or intravenous, can speed up the healing process after surgery or after burns. When applied topically, zinc oxide improved wound healing in rats and pigs. Prenatal zinc supplements in 240 pregnant women for a poor region significantly improved bone development in their babies. In 32 young people with thalassemia, a blood disorder, 147 girls were given zinc supplementation and it improved bone density. Another study revealed that zinc supplementation increased bone formation markers in healthy men. In lab animals and test tubes, zinc was able to increase bone density and strength by enhancing bone formation and by preventing bone loss. In a clinical study of 200 bald men, topical zinc was able to improve hair growth. Additional research suggests that zinc's antimicrobial, anti-inflammatory, and antioxidant effect on the scalp is potentially involved in increasing the hair density. Another study in women with polycystic ovarian syndrome, or PCOS, showed that zinc supplementation had beneficial effects on a number of symptoms, including alopecia or hair loss. Zinc treatment also reversed hair loss in patients who underwent vertical gastroplasty, which was stomach stapling, a surgical operation that can result in a zinc deficiency. Restoring zinc levels in chronic kidney disease patients on hemodialysis can improve overall kidney function and reduce many complications that are associated with the disease, like heart disease, anemia, infections, and sexual dysfunction. The effects are likely achieved by reducing inflammation, oxidative stress, and cholesterol, as well as enhancing hemoglobin, sex hormones like testosterone and luteinizing hormone, and improving immune function. Low blood zinc levels are associated with pregnancy complications like spontaneous abortion, preeclampsia, extended pregnancy, preterm birth, and abnormal fetal development. Studies have shown that maternal zinc supplementation in zinc-deficient or underweight women can reduce the risk of preterm birth and protect against fetal damage from alcohol exposure. A study found that Indian mothers receiving supplemental zinc had longer gestational periods or pregnancy time and babies with healthier weights. Another study in pregnant women with low blood zinc levels found that zinc supplementation, 25 milligrams per day, during the second half of pregnancy significantly increased infant birth weights and head circumference. It's proposed that these beneficial effects are a result of its ability to inhibit embryonic cell death, increase growth factors like insulin growth factor, PDGF, and FGF, and to reduce oxidative damage, all of which help to promote healthy fetal development. In a number of studies, zinc supplementation produced significant beneficial effects on both height and weight measurements of children, especially in underweight, malnourished children suffering from stunted growth. A dose of 10 milligrams of zinc daily for 24 weeks increased net growth around 0.37 centimeters in height when compared to children treated with a placebo. Maternal and infantile zinc supplementation increased weight and muscle mass in 2 studies in developing countries. Zinc deficiency is associated with hormonal imbalances that can lead to ovarian function problems, menstruation irregularities, and infertility. Several studies have found that oral zinc administration, in combination with mefenamic acid and alone, was able to reduce the severity and the duration of menopausal pain in women. Studies have found that zinc supplementation in women with PCOS can reduce insulin levels and improve disease symptoms like body hair growth and balding. Women with endometriosis, a condition where the tissue inside the uterus grows outside of the uterus, exhibit low blood zinc levels. One study reported that an intake of antioxidants like vitamin C, vitamin E, selenium, and zinc was inversely correlated with the severity of endometriosis progression in women, indicating that zinc can slow the development of this disorder. In 60 patients with non-alcoholic fatty liver cirrhosis, supplemental zinc improved liver function and it prevented excessive copper accumulation, which can damage the liver. It was able to improve liver function based on alkaline phosphatase and bilirubin levels in 30 patients with alcoholic liver cirrhosis. Zinc supplementation in animal models of alcoholic liver disease, or ALD, protected the liver by blocking most mechanisms of liver injury, like gut leakage, endotoxemia, oxidative stress, excessive inflammatory cytokine production, and liver cell death. Zinc also improved the outcome of 62 patients with hepatitis C which, if left untreated, can lead to liver scarring. People with tinnitus or ringing in the ear have lower levels of zinc in the blood. In a trial of 41 participants, a zinc supplement of 50 milligrams per day for 2 months was able to reduce the severity of tinnitus in 82% of the patients. In another study, the addition of zinc to oral corticosterone was associated with a greater improvement in symptoms in 66 people with a sudden hearing loss for unknown reasons than by the corticosterone alone. Otis media is an infection of the middle ear. The effects of zinc supplementation on this are mixed. The benefits may be limited to malnourished children with zinc deficiency. Zinc deficiency is linked to impaired hearing in mice and rats, and this can be improved with zinc supplementation. This is likely a result of zinc's protective effect against toxins in ear structures. Zinc deficiency can lead to excessive plaque formation and worsen the inflammatory process in gum disease. Zinc-based mouthwashes were found to be effective in reducing plaque growth. Similarly, a study in children from low-income areas found that a daily intake of 15 milligrams of zinc for 10 weeks was associated with reduced plaque formation on the teeth. Zinc-containing toothpaste, mouthwash, and gum may also help gingivitis or gum inflammation and bad breath. Bromhidrosis, body odor, is usually associated with an increased bacterial flora in the armpit region, mainly consisting of Staphylococcus or Corynebacterium species. Because of its antibacterial action, topical zinc has shown efficacy in reducing armpit and foot odor in clinical studies. In 30 Alzheimer's disease patients, zinc supplementation protected against cognitive decline by lowering blood copper levels and by improving zinc nutritional status. According to the authors, copper toxicity may play a role in the development of Alzheimer's. In different animal studies, zinc was neuroprotective in moderate concentrations, and it helped preserve learning and memory function. In a mouse model of Alzheimer's disease, zinc supplementation reduced pathological factors that were associated with the progression of the disease, like beta amyloid and tau protein. It also improved mitochondrial function and brain-derived neurotrophic factor, or BDNF, levels in the hippocampus. Seminal zinc concentration was positively correlated with sperm count, motility, and viability in different clinical trials. This is likely because of zinc's role in stabilizing the cellular membranes and the DNA by reducing oxidative damage of the sperm and enhancing spermatogenesis, the formation of new sperm cells. In infertile men with low blood testosterone, supplemental zinc led to an increase in sperm count, testosterone, dihydrotestosterone, and fertility. Low to moderate doses, 12 to 120 milligrams per kg of zinc, appeared to enhance the reproductive function in rats. Zinc is highly concentrated in the prostate and the testes, and it's involved in the synthesis of testosterone. In rats, zinc was able to preserve testicular function, as was measured by testicular weight, sperm concentration, and testosterone levels, in response to oxidative stress that was induced by cigarette smoke. One study found that blood zinc levels were significantly lower in chronic fatigue syndrome patients and that symptom severity was negatively correlated with blood zinc levels. The study concluded that zinc may be effective in attenuating chronic fatigue syndrome symptoms because of its antioxidant and anti-inflammatory properties. Gut inflammation caused by a leaky gut is common in people with chronic fatigue syndrome. A study found that treating leaky gut with a mixture of anti-inflammatory and antioxidant substances, including zinc, in chronic fatigue syndrome patients resulted in significant improvement of their symptoms. Lab studies show that zinc is involved in regulating pro-thrombotic or clot forming and anti-thrombotic clot-preventing factors derived from platelets and blood vessel lumen. Hyperzincemia, high levels of zinc in the blood, can cause blood clotting, while hypozincemia, low levels of zinc in the blood, can lead to prolonged blood clotting times. Both conditions cause impairments in platelet aggregation and abnormal bleeding. One study revealed that restoring zinc levels in zinc-deficient men led to normalized platelet aggregation and blood clotting time. A study in obsessive-compulsive disorder patients showed that the addition of zinc to fluoxetine, or Prozac, therapy was able to reduce symptoms. Its ability to suppress glutamate release and transmission may have contributed to the improvement. A study in schizophrenic men found that zinc in combination with risperidone improved many symptoms that were associated with the disorder, like aggression, hallucinations, and delusions. This effect is in part attributed to its antioxidant and antidepressant properties. Zinc deficiency has detrimental effects on the gut lining of animal models and humans in a variety of gastrointestinal diseases like inflammatory bowel disease, diarrhea, cancer, alcohol toxicity, and colitis. In most cases, zinc supplementation can provide improvement. In rats and mice, scientists tested its ability to stabilize the gut mucosa and to reduce injuries by enhancing gut repair processes in rats and mice. Zinc also protected the intestinal mucosa from alcohol-induced damage in rats and mice. It can prevent gut leakiness, which may reduce the risk of developing inflammatory bowel disease. A study in patients with dyspepsia or indigestion found that inflammation in Helicobacter pylori-induced stomach cancer was negatively correlated with zinc concentration. Several studies have reported a marked decrease in blood zinc levels of patients with intractable epilepsy. In one study, zinc therapy significantly reduced the frequency of seizures in 31% of the treated children. Scientists examined the potential of zinc supplementation to reduce seizure frequency in rats. In lab animals and test tubes, a zinc deficiency was associated with a decline in thyroid function due to low levels of T3 and free T4. In 134 disabled hypothyroid patients under anticonvulsant therapy with mild to moderate zinc deficiency, zinc supplementation was able to normalize thyroid hormone levels in the blood and restore thyroid function. A study of 25 children with Down syndrome suggested similar effects of supplemental zinc. Zinc supplementation was also able to reverse the damaging effects of computer monitor emitted radiation on the thyroid hormone levels of computer workers. Mucositis, or ulceration of the mucous membrane, is a common side effect of chemotherapy and radiotherapy. Studies in patients who underwent chemotherapy and radiotherapy found that zinc supplementation was able to reduce the severity of the oral mucositis. Dysgeusia, or distortion of taste, and dysomia, distortion of smell, can also occur during chemotherapy. A study found that a daily intake of 100 milligrams of zinc for 4 to 6 months improved dysgeusia and dysomia symptoms in patients with carbonic anhydrase 6 deficiency. Zinc can stimulate the production of carbonic anhydrase 6, which is an enzyme in saliva that's involved in taste bud growth. In a study of 79 autistic children, the severity of symptoms like awareness, hyperactivity, receptiveness to language, focus and attention, eye contact, sound sensitivity, tactile sensitivity, and seizures decreased after zinc and vitamin B supplementation. The children had higher copper levels, which reduced upon the supplementation. Prenatal zinc treatment prevented autism-like behaviors, such as induced social deficits, repetitive behaviors, and cognitive inflexibility in rat offspring, indicating a possible link between its deficiency and autism development. In one study on adult mice, scientists observed the potential of zinc supplementation to prevent the development of autism-related behavior. Metabolic syndrome is a cluster of conditions like obesity, insulin resistance, high blood pressure, and high cholesterol, and it can increase the risk of heart disease and type 2 diabetes. A study in 60 children with metabolic syndrome found that zinc supplementation decreased insulin resistance, oxidative stress, inflammation, blood sugar, cholesterol, and body mass index. Women and children with higher blood zinc concentrations have better sleep quality, according to some researchers. 2 studies in infants revealed that zinc supplementation was able to prolong sleep duration. However, 1/3 of the children had stunted growth and were likely zinc deficient. Opioid users exhibit lower levels of zinc. Studies in mice and rats found that zinc reduced dependence intensity of morphine, which is an opioid, while zinc chelators intensified withdrawal symptoms. A study in 10 wrestlers found that heavy exercise can significantly deplete thyroid hormones and testosterone levels, which can lead to exhaustion. However, zinc supplementation was able to prevent this loss and benefit the athletic performance. In animal studies and test tubes, researchers have been investigating the potential benefits of zinc supplementation and optimal zinc levels for bacterial infections, transplant rejection and autoimmunity, radioprotection, and pain relief.